Hi, I'm John Dean with Dean Dental Solutions, and I'm excited to tell all our patients, friends, neighbors, and team members that the Governor and the State Department of Health and the State Dental Board has said that dentistry can go back to work starting Monday, May 11th, and we're planning on doing that because we are prepared here at Dean Dental Solutions. So I wanted to go over to anybody who's interested, new patients, patients of record, of what to expect when you come to our office. First of all, when you walk through our front doors, you'll see a sign in our lobby that says stop and read. This is about the coronavirus and the precautions that you should be taking for the coronavirus. We've already questioned you when you call to make your appointment. We're not accepting any walk-ins. You have to call and make an appointment. But I would like for you to go ahead and get some alcohol on your hands. This disrupts the virus and breaks it up. The gold standard is washing your hands for 20 seconds or more with soap and water. But right now, if we don't have a sink right here, you can do this and it protects you. We're going to keep the doors open so you don't have to touch the handle. If you walk inside our office, first thing that's going to happen when you come in, this is mandated by the State Department of Health, but go ahead and grab one of our face masks and put a face mask on. Everybody in the office must have a face mask on at all times unless we're working on you. It's going to be kind of hard to do dentistry with the face mask on the patient. But besides that, everybody else is going to have a face mask on. So we're going to take your temperature with a digital thermometer, and we're also going to take your pulse ox. What a pulse ox tells you is how much oxygen is in your bloodstream. This is a SARS virus. It's a respiratory virus, severe acute respiratory syndrome. So it attacks your lungs. Healthy people should have 95 or above pulse ox. If you're below 90, we're going to test you again. We'll take you to the surgery room in the back and test it with the hospital grade equipment. And if you're still below 90, we're not going to be able to see you, and we ask you to go to see your doctor or to get tested. So I'm 98 right now. My pulse is 64. We're very relaxed. So as you come in, all of our ladies are going to be masked. When you pay, all this is disposable. So we rip that off and put another one on. We wipe everything down. The bathrooms, we have soap and water. You can wash your hands before we start treatment, but you can also, we're going to walk you straight back. Nobody's staying in our reception area. When you walk straight back to the treatment room, everything will be covered and you'll be able to sit down with your mask on. Anybody that comes in the room will have a mask on. As our patients are sitting in the chair, when I enter or my assistant enters, we won't necessarily have gloves on right at that time, but we'll always have a mask on. This is an N95 mask. It protects what we may be breathing out and what you may be breathing in. So if you do have to have dental work done, this is how it's going to look now. This is the new normal. We have a face shield, we have the N95 mask that you're not supposed to touch, and we have a surgical gown that we sterilize or throw away after use. I also wanted you to have confidence in our sterilization center. First of all, we're going to limit traffic in our sterilization center to only the people that are sterilizing instruments. They'll be wearing an N95 mask and they'll be wearing clean gloves. Our sterilization center goes from dirty to clean. Red is dirty, blue is clean. We have a pre-sterilizer, washer, and dryer. And so this is state-of-the-art $10,000 machine that will get all the debris off and clean it and dry it. It's very important that instruments come out dry. Floating airborne pathogens cannot attach themselves to dry instruments. They attach easier to wet instruments. So then they come down and we put them in our sterilizers. We have this newest sterilizer is a hospital grade sterilizer that pulls a vacuum 7 times, and these come out completely dry in a pouch. It is the state of the art. There's not a better one on the market. Since we remodeled this office, we went down to the studs, all the water lines that feed the sinks and the patient treatment rooms are sterile water, and therefore you're not getting bacteria in your water lines. When we ask you to leave, you're gonna wash your hands with soap and water. This brand new. So we wash our hands for 20 seconds. Say the ABCs. A, B, C, D, E, F, G, H, I, J, K, L, N, O, P. Once you wash your hands, you're leaving with your mask on. You can take the mask with you. And this is the way that we can protect you and also our team members. But the whole thing about this coronavirus, the phase 1 of back to starting our economy back up, is that we have to continue to be safe. So when you enter our office, you're going to put a mask on. Everybody's going to have a mask on. Your safety is paramount. Our team's safety is paramount. But we also want to get back to doing dentistry, and we want you to keep your oral health, keep your beautiful smile, keep your teeth for life. That's our goal, and we're ready to see everybody. And so I appreciate you taking the time to watch this. Be safe, come see us, and have a great day.